Greeting peoples of tomorrow. We are Encore 36 podcast from AMSA UTAR. Welcome everyone to Dessert Dilemma, a talk on diabetes. I'm Barry. I'm your MC and the host for this section, and today we will dive into the intricate world of diabetes with our esteemed guest speaker, Dr Malathi, an endocrine specialist. Doctor, could you introduce yourself to the audience?
Hi everyone, I am Dr Malathi Karupiah and a consultant endocrinologist from Prince Scott Medical Center. Thank you for having me.
Thank you, Doctor. So, before we actually dive into the specifics, let's start with some basic knowledge about the diabetes. So, what exactly is diabetes? According to what I know from WHO, diabetes is a chronic metabolic disease characterized by elevated levels of blood sugar. In the long run, it can lead to damage to the heart, to the blood vessels, to the kidneys, and to the nerve. So, Doctor, can you shed some why is it really an important topic to us, particularly to the healthcare sections?
Okay, so thank you for that. What's your name?
Barry.
So thanks for that question. So diabetes, I think, why is it so important? Because it's very, very common right now. If I were to take just Malaysia alone, 1 in 4 people actually has diabetes. And if you look at the prevalence that they have studied, a lot of patients are also in the category of pre-diabetic. So we are trying to catch those people who are in pre-diabetic who are unaware, because they usually do not present with any symptoms. Now, there's enough studies to actually show that pre-diabetic itself can already start complications as diabetes per se. So I think it's very important that bringing awareness about this disease is very important. And always I tell my patients that it's a silent killer. So you don't really know what's coming until it actually gets to you.
Yeah, true. I agree with that. So, Doctor, would you mind to explain to us what are the symptoms, causes of diabetes?
Yeah. So symptoms of diabetes are basically patients might feel they regularly need to wake up at night to go and pass urine. So we call it polyuria in our medical term. Some patients will frequently feel very thirsty. And some patients will have unintentional weight loss, and they might be thinking, oh, I'm eating a lot, but I'm still losing weight and all that. But those are unhealthy weight loss if you look at a bigger picture. Sometimes some patients will actually also notice that after passing urine in the toilet, they might have actually ants, a lot of ants around it. So that's another telltale sign. And the other thing also is patients who actually develop any wound and they have slow healing wound. So these are the patients that usually are the common patients that come to us, and then we notice that they have developed diabetes.
Thank you, Doctor. So now when we go to urine, we need to see that whether our urine is clumped with lots of ants or not, to see whether it's a sign for the diabetes.
Yeah, I mean, it's just a telltale sign. It's not going to happen frequently though.
Yeah, true. Alright, so thank you, Doctor, for the explanation. Now, I would like to ask that, what is the impact? As a person who is actually diagnosed as a diabetic, what are the impacts to them physically and emotionally?
Physically and emotionally. Okay, good question. So let's talk about physical first. I think number one, the denial. A lot of patients are always, they cannot accept that they have been diagnosed with diabetes. And, all the questions of why, how, where, when, and what should they do and what should they not do, how to prevent not taking medication. Yeah. So that's the very famous questions I always get. So I think physically, patients will feel very tired. They'll feel very lethargic. The concentration power also kind of reduce. Their performance will kind of deteriorate at wherever they are. I'm not only talking about elderly patients or middle-aged class patient. I'm also talking about young patients like yourself. I'm getting a lot of teenagers right now who's also, and young adults developing diabetes, and they are in shock. Especially the teenagers. I mean, I think parents are the one, firstly, I have to kind of calm them down and tell them that no, it is diabetes, and they'll be shocked. They'll be like, how is that possible? He's so healthy, and then now this just happened. So physically, I think it takes an impact not only on the patient, but the whole family. If you talk about mentally, I think mental health is a huge topic right now. Everyone's talking about it.
Yes.
I think when they find out that they're diabetic, to actually process it itself takes some time, and for the matter of fact, they have to be on lifelong medication. I think that's where they find it very difficult to sort of like accept it. So yeah, I think it takes definitely a big toll on both physical and mental aspect.
Thank you for the very clear explanation from Dr. Malathi. So, as a person who actually diagnosed as a diabetic, so if we were their daughter or sons, how should we actually take good care of them so that to prevent the diabetes from getting worse?
Okay. So I'm not sure how many of y'all actually do have parents who are diabetic or hypertensive, or having a cardiac issue, a heart problem. So it definitely is not easy when it comes to your own family members. I think the first thing is to kind of be supportive for them and be present and kind of tell them that it's going to be a long journey, but as long everyone is on board and on the same wavelength, I think it takes a big impact. I do see a lot of, especially I tell my patients that come, usually they come on their own because they probably came for medical screening and they notice that they're diabetic. So I'll always tell them to bring their spouse. Why? Because I think it starts at home. So as much as they can come and see me, I mean, they're seeing me once a while for their blood checks and, looking how they're faring with it. But when they come with their family member, I think they get a bigger picture. For an example, one of my patients, came and saw me, and he was initially very fat. His BMI was big, and he was eating everything under the sun because the wife used to cook and whatnot. Then he started losing weight after seeing me because I advised him in regards to lifestyle management. So he's doing the right thing. But the wife then came the next follow-up and was like so upset. She was like, what did you tell to my husband? He's not eating my food and all that. So when she came and she kind of saw the results and I explained to her, then she got a bigger picture and, then she understood. So then when they worked together, exercise was not a problem because they will do it as a family. And at the same time at home, the choices of food was better choices. They were able to choose things that they all can eat together so that in a way it helps the husband or the wife out.
True. I actually strongly believe that in all kind of circumstances that family is the strongest support. Yeah. So, and for diabetes mellitus, because we now already went through like the symptoms and also the causes, so we would like to know how are we going to prevent this from occurring into us. Like doctor, you just mentioned, it's not only like elderly, not only middle-aged individuals, but also teenagers. So how are we going to prevent it?
Okay, so good question. I think now medicine is moving towards prevention better than cure. Now, how do we prevent diabetes? I think number one is being aware of risk factors. So what kind of risk factors I'm talking about? So it could be very strong family history, obesity itself. So I think it's very important that we maintain a certain BMI. And if we do regularly eating outside and eating processed food, I think we also need to look into that, what kind of choices of food we are eating. And knowing what are the symptoms of diabetes itself, like what I mentioned, increased thirsty, passing urine a lot, unintentional weight loss. This all should be triggering factors wanting you to go and get yourself checked. At the same time, I think when I talk in a bigger picture, pregnant ladies, that's another topic on its own, but I always tell them if you already develop diabetes in pregnancy, there's something called gestational diabetes mellitus in pregnancy. A lot of them after giving birth, they kind of just let go. So that itself is like a risk factor for them to actually anticipate the possibility of them actually developing diabetes further on. Having other risk factors such as smoking, a strong family history of cardiovascular symptoms, that means any heart issues, or a young patient who has hypertension alone without any diabetes, they are also at risk of developing diabetes later on. So I think just doing annual checkups, they used to tell patients to do annual checkups after the age of 40, but now no more. It's as early as 20 itself. I think it's very important. Teenagers, I think is a bit more difficult, but I think as long as you have strong family risk factors, I think it's encourageable to ask them to do regular checkups as well.
Thank you, doctor. But just now you mentioned about gestational diabetes. So I was wondering, actually how many types of diabetes there are?
So it's not just one type of diabetic which everybody thinks there is. So the commonest that we have is actually type 2 diabetes. All right, so that's more of insulin resistance. So if I were to talk more of, make it more simpler to understand what's insulin resistant, because that's a very common question. It's like, are you a coffee drinker if I were to ask you, Barry?
No, I'm not.
Okay, so you're like me. I don't drink coffee, but a lot of people actually do drink coffee, and some of them can actually, drink 3 to 4 glasses a day, and they even can have one before they sleep. But a lot of people have this thing where caffeine prevents you from sleeping, right? But why are these people are able to still sleep despite having 3 to 4 glasses? So they've kind of developed resistance towards caffeine. The same thing with insulin resistant. When you just let go, and all of us are guilty as charged. We've just developed all these bad habits throughout our life. We just eat everything that's around us, and Malaysia's abundance of all types of cuisine. We just eat because it tastes good, right? What happens? Your body cannot cope. It can't cope, so the insulin is unable to kind of like compensate for the amount of food that you're eating. So it doesn't work anymore. It's not enough. So what happens? Extra insulin that is being produced goes into the fat, and it causes you to increase in body fat as well. So you develop sort of like an insulin resistant to its, the work of it. So it doesn't work to bring down your sugar levels. Hence why you need other modalities like your oral medication or an injectable to help you to sustain your sugars. Yeah. So the type is type 2, type 1. You also have something called LADA, latent autoimmune diabetes, and also you have MODI, that means maturity onset of diabetes, and the final one is like what I mentioned, gestational diabetes in pregnancy. Now, what is the difference between the other three? Type 1 is more of an autoimmune problem. That means most of them sometimes develop an antibody that attacks their pancreas, so it doesn't function anymore, so they do not have insulin production. And so those are the patients that's very, very dangerous, where we need to continuously give them insulin, and if they don't take their insulin, they'll go into a very a medical emergency called a very acidic state. All right, we call it ketoacidosis. Now, the other one is LADA. LADA is also an autoimmune problem where it's an adult onset of the type 1, meaning these are more than 30 years old. They are probably for the 6 months, their cells that produces insulin, which is called beta cells, produces the insulin, and in time it actually depletes because they go into something called glucotoxicity. Then they cannot produce anymore, and hence why they will require insulin. Then of course you have the MODI. MODI is more of a genetic type. So this is something very, very least commonly diagnosed, because to do the testing is so expensive. We have to either send to Hong Kong or the United States of America. It takes about 3,000 to 4,000 ringgit to actually do this genetic testing. These are patients who are less than 25 years old. They have 3 family history, meaning they themselves, their parental, their grandparents all have very strong early onset of diabetes. So I think there's multiple genetics that they have discovered right now that is under the umbrella of MODI. So those are the patients that some of them can be just on medication, but some of them can become very, very depleted with their insulin, and they'll develop complications, and then they'll be on insulin replacement.
Interesting. Now everyone be like very clear, like, wow, diabetes, we are actually about 4 types, about what doctor mentioned. Because as we teenagers, if we are actually not exposed to the topics of diabetes, we actually would think like, oh, just one type of diabetes. If you get diabetes, then straight away diabetes. But after hearing doctor's explanation, now we know like, actually it's not just one type.
Yeah, it's not as simple as that. So that's why you have to, when you get to know your diabetes, go and see an endocrinologist, because we know what kind of types to kind of categorize you and what kind of medication needs to be started. So there's no one medication for all. So diabetes is a very individualized treatment. And the complication, I think it's so important that patients know, like I said, it's a silent killer. So you can get affected by your eyes, your heart, and your kidney. So anytime you suddenly can just go blind, and sometimes kidney can fail, and you can just have a bout of a heart attack and nobody will know. So it's very important that awareness is spread.
True. Yeah, so I was wondering that, because I heard of a lot of people, they say, so if I were diagnosed as a diabetic, so will I get like completely cured? Yeah, so I think this is quite an interesting topic to be discussed.
Thank you. That's a very interesting question. I get it all the time from a lot of audience when I do give talks as well. So we don't believe in using the term cure. It's a term. all right? But what we can say is reversible. So diabetes is reversible, but curing it is something very subjective. So there are landmark trials that have been proven that it can be reversible, especially a trial where it involves very low calorie diet, or even the surgery, bariatric surgery, in regards to losing weight. So they have seen that there's remarkable reversible of diabetes, where patients, some group of patients actually initially was on medication, once going through a good weight loss program, either surgical or medical, that they are able to sustain their diabetic levels at a very good level, that they don't really require any intervention, and just by doing exercise and diet. So we always advocate lifestyle management. So even anybody, whether it's a newly diagnosed or someone who's had diabetes for a long time, we always advocate lifestyle management as the first modality. Then only we kind of incorporate the medications.
Thank you, doctor. So I believe that we have actually explored more about the knowledge of diabetes. Yeah, so I would like to wrap up, before we end this section, I would like to wrap up some key points during our conversations from the doctor's explanation. It's like, for example, like the symptoms of diabetes. So it's like the first thing, like during the night you have polyuria. It's something like you will actually have frequent urination during the night time. And also when you have urination, your urine will be clumped with lots of ants.
And be frothy as well sometimes.
Or be frothy as well. And also maybe you have like a very huge BMI, or I would say like a very high BMI. Yeah.
Obesity.
Obesity, yeah. So, and that will actually leads, is like a very important risk factors, that will actually leads to the problem of diabetes.
Yeah.
And the next thing would be like, how are we actually, like just like doctor you said, that we actually cannot say to like really cure it, because the curing is just a term, right? But we would say like it's to reverse, like the diabetes is quite reversible. Yeah. So like maybe you're going through some really less fat diet to lower down your BMI. Yeah. And also as a doctor, if our parents or our grandparents, they were diagnosed as a diabetic, so what are we going to do is like just to support them and also check their diet to make sure that they actually have a very balanced diet, not only like fast food. Yeah. And when we talk about fast food, doctor will say just say that actually having fast food is also one of the risk factor, because it's very high fat. Yeah, it contains a lot of fats and actually increase our BMI.
Do you know how much calorie is in a snack plate? KFC snack plate.
KFC snack plate.
How many chicken is in a KFC snack plate?
2.
Yeah, so what do you think is the calorie?
Maybe 1,000.
So it's about 1,200.
Oh, 1,200.
Yeah, so
wow,
imagine
that's very high.
That's one meal that you have, and that's itself. It's like, it's just gonna increase your calorie intake.
True.
Yeah.
But I think we need to take note of this, because nowadays as teenagers we want to save time, so we actually when we see KFC, let's go KFC and let's eat, and 1,200 calories is in our body.
Yeah,
and it comes easily, but it didn't go easily. Like we need to exercise really frequently so that we can burn out the 1,200.
What's your meal like, Barry?
I actually every day, because to save time, I wouldn't go for KFC and McDonald's actually. I don't really prefer fast food, but at the same time I don't really like veggie somehow.
Oh.
Yeah. So
you go for your chap fan?
Yeah, I go for chap fan. Yeah. Like I will take one meat first. I'll take a meat first. And then the veggie, I won't take veggie, but I take tofu.
Why?
Because
you don't like your veggie?
That's
the first thing I tell all my patients to take. Do you know veggie contains high fibers?
Yeah, I know that. And also low calorie. Yeah.
Yes.
Okay, doctor, I will promise. Maybe I'll try to eat more veggie after today's discussion.
Sure, very good.
Okay.
I'm glad I've shed some light.
Yeah, true. And just now we talked about the types of diabetes, right, doctor? You said that actually type 2 is more common among us. How about type 1? Because you say it's like more like genetic problem, right? Type 1.
It's more of an autoimmune. It's an autoimmune problem. It's not as common as type 2. Type 2 is more of because of your lifestyle, your risk factors that you develop. So type 1 is more of like, you have an autoimmune problem that's attacking your pancreas. So most of the time, it's not very common. Yeah.
I see.
And
So
they're very insulin dependent.
so means once they were born, so they already need the injection of insulin
Yes.
till the end of
Yeah.
their life.
Yeah.
I see. All right. So for type 2, it's still modifiable, I would say.
Yes. Yeah.
Because if we actually can handle the BMI, so we actually can prevent us from getting the type 2 diabetes.
Yes.
I see. But if for the
I
type
think
1,
it's a whole thing. You can't just say BMI. I think it's more of a lifestyle management. So lifestyle management encompasses of diet and exercise. And, I think a lot of people struggle with that. So it encompasses both of it. So it's not one better than the other. You have to do it simultaneously.
I see. True. It's like, according to what I know, that as a teenager, like me, I'm now studying. So
How old are you?
I'm 22 this year.
Teenager.
Yeah, teenager. Yeah. So, like just now when doctor you say that actually diabetes, right, not only middle age or elderly, but also teenager, that actually I was shocked. Maybe I will need to get some screening already. Yeah, because preventing is better than cure.
Yes.
Yeah. So, like my lifestyle, I often like prefer to sit and study.
Okay.
Yeah, so I actually don't have really much time to exercise. Yeah.
But you got 24 hours, what?
Yeah, but somehow 24 hours is never enough
Never
for
enough.
medical student.
Well, I was a medical student.
But it's not enough for me, maybe.
Not enough for you?
Yeah.
I'm sure you can find the time. What
Yeah.
time do you wake up in the mornings?
Morning, Last time when I was motivated, maybe 5.
5.
Now, not motivated, maybe 8.
So 8. So you've lost 3 hours of your life.
Yeah.
Every day. So you can use so many you can do so many things in that 3 hours.
Yeah, true.
Yeah. You should wake up maybe
Early.
6 o'clock. 6 o'clock also is something acceptable. And just use 30 minutes of your time to just walk or run.
Yeah, true. And I remember that, how to say, it's like diabetes is like a disease. But
Like what? Sorry?
it's a disease.
Oh, disease.
Yeah, it's a disease. But in order to prevent it, just like doctor you said, it's not only look into one category. But for me, it's like how the way that you handle your lifestyle. For example, like maybe a few months ago, I was motivated, so I used to wake up
How
6.
come you lost the motivation?
Maybe because this semester is more about assignments.
I see.
Because the previous SAM, we actually used to have a lot of exams. So I need to wake up early to change back the time.
Okay.
Yeah. So when I realized that actually when I wake up earlier to do maybe some exercises, I did it before I go to school. I realized that not only that my BMI will decrease, but also the mind, like mentally, you feel happier.
Yeah.
Like you feel satisfied that you actually done a lot of things before you go to school. Yeah. So I think it's like, people will think like, oh, losing weight is like so, how to say that, it's like so, it's so
Difficult?
difficult. Yeah, the word difficult. It's like so difficult. But for me, it's like you feel mentally healthier and happier.
Yeah.
Yeah, by
Because
exercising.
if I were to talk scientifically, what does exercise do?
Exercise actually release the dopamine to make you
Yes.
feel
So what
happy.
are dopamine, adrenaline? What are those? What do you call? Happy
Hormone,
hormones.
happy hormones. Yeah, happy hormones.
That's why you feel better.
Yeah, true.
Right?
Yeah.
So there's no myth to it. It's actually scientifically proven already.
Yeah. So I think I can need to wrap up our discussion today.
Okay.
Yeah. So basically, like the symptoms, like what we say is like the polyuria. We have urination, frequent urination during the night time, which actually won't occur in normal person. And also the BMI, will actually increase. And also like maybe you will feel very lethargic. You don't have the energy to do something. Which actually is not normal. Yeah. And for the types, as we just mentioned, about 4 types, type 1, type 2, and the most common one would be type 2. Yeah, and how to prevent is like, doctor you say, it's not about how to prevent and how to cure, but it's scientifically proven that diabetes is actually reversible. If you actually follow a very low-fat diet. Yeah.
Lifestyle modification. Keyword.
Yes. Lifestyle modification.
Yeah.
Okay. Thank you, doctor, for the very clear explanation. So, is there anything that doctor would like to top up?
Okay, so firstly, thank you to Utah for having me here for talking about diabetes. I think it's a very, very important topic. I think the only thing I would probably re-emphasize is that lifestyle management is the most important thing that I think all of us need to advocate. And I always do tell my patients that two things is very important, which all of us are guilty as charged for not practicing, is consistency and discipline. I think if we only advocate this from as much as we can on ourselves and also to the people that we care about around us, I think diabetes can be something that we can prevent. So, a lot of people are worried about initiating medication. I think the biggest myth behind it is that it's not the medication that's going to cause the problem. It's more of the diabetes itself that can lead to all the complications arising. So if you do not take the medication as prescribed and with close monitoring, then the complications will set in and it'll become more advanced. Thank you. Thank you for having me.
Thank you, doctor. So, for sharing your expertise with us and our audience today. So, before we call it a day, we would like to have an appreciation to doctor for coming with us today.
Oh, thank you.
Thank you, doctor.
Thanks. Thank you.
Okay. And to our listeners, thank you for tuning in to Dessert Dilemma, a talk on diabetes. Remember, knowledge is power, and by spreading awareness about diabetes, we can work towards a healthier future for all. Before we sign off, don't forget to follow us for updates on future episodes and continue the conversation on our social media platforms. Stay tuned for next week's episodes as we dive deeper into the topics of metabolic syndromes. That's all for today on Core 36 podcast episode. Once again, thank you all for tuning in. Building bridges, sharing dreams. Viva AMSA!